It's always something technical. Now, you were with me. We didn't even touch them.
Good morning.
Don't have us on mute, okay?
Good morning.
Yeah, good morning to the panelists and everyone in the audience. My name is Dr. William Leahy, and I'm chairman of the board of Maryland Regional Direct Services Collaborative. We want to thank the Rodham Institute, and in particular, Christina Williams, for her work in preparing today's webinar. The collaborative is now in its almost third year, and this was founded with an interest in looking at the workforce for direct services individuals. And our focus over the last couple years have been in looking at the workforce supply, looking at training and education for the workforce, and secondly, in the area of wages and benefit. This was our focus until March of this year. As we all know, March changed the world, and we are in an entirely new chapter in our existence. For this reason, the collaborative also began to think about ways in which we could look at the issue of how COVID has affected the workforce that we find so precious and so important, and really ways in which we could improve the whole experience. And as a reaction to this, we have developed these three webinars. Today will be the first of the webinars looking at the frontline direct services workers and confronting the pandemic. On the 2nd of October, the second of the webinars will be available, which will look at putting new practice solutions to work to try to identify and to assess the best practices and measures that we could take during the pandemic by providers, employers, and also public action to support the workforce and the population served by workforce individuals. And the third seminar, which will be on the 22nd of October, will look at the future, transforming the direct services workforce, how COVID-19 has provided opportunities to transform the direct services workforce, both in terms of the quality and also the availability of service. So we have shifted our focus, the collaborative's focus, a bit. We hope that over time, all of you in the audience will join the collaborative as associate members. Today, we have a very action-packed curriculum, and we're going to be essentially having three very special and very well-trained individuals help us. The first will be Wayne Turnage, who is the Deputy Mayor of the District of Columbia. Prior to stepping up to his particular role in the district as Deputy Mayor for DC Health and Human Services, he was the Chief of Staff in the Virginia Commonwealth to Governor Tim Kaine, and he also has a master's degree in public administration. So he's well prepared to look at the policies that are so necessary, and Wayne and his group have done an exceptional job during this time of the pandemic. So I'd like to introduce the keynote speaker now. Wayne, we're going to turn this over to you for the next 10 minutes. There will be much material that will be consumed, but I think all of it will be terribly important to set the stage for a discussion with our direct caregivers. Wayne, take it over.
Thank you and good morning. On behalf of the Maryland Regional Collaborative, I would like to welcome all of you to this important event, which, as noted, aims to shed some light on the issues faced by frontline workers during what is undoubtedly a remarkably challenging period in our country's history. You know, against the backdrop of what happens to be a rapidly evolving and fairly pernicious pandemic, DC, Maryland, and Virginia are not unlike jurisdictions all over the United States, which have been forced to adopt some fairly draconian measures in a desperate effort to slow the viral spread of this novel disease. I think these restrictions have been quite effective in some places in minimizing viral spread, saving thousands of lives in the process, but they have also severely dampened commerce and business income across the country. And this has, in many cases, effectively choked the revenue streams that are needed by local and state governments to fight this disease. Meanwhile, as noted, our nation's health systems stand on the front line in this fight to contain the virus, exposing hundreds of thousands of healthcare workers to new dangers as they provide care for the infirm. We now know that there are more than 6 million reported infections in the United States, and that's just reported. Some estimates are that the number is likely 10 times higher. We could have as many as 60 million people walking around with the disease. And sadly, in excess of 190,000 people have succumbed to this disease. In my brief time with you this morning, I will offer a rather high-level view of some of the challenges and summarize some of the steps we've taken in the District of Columbia to mitigate the significant barriers faced by our frontline workers. And this includes personal care aides, nurses assistants, and also general nurses assistants. In the 10 minutes allotted me for these remarks, it is not possible to fully discuss both the impact of the pandemic and the current trends for the virus in this region, or comprehensively lay bare the unique problems posed for our healthcare workers. So what I've decided to do is I've provided a document that provides some detail on these points for your later review. And in the interest of time, I would ask that Melanie draw your attention to a few of the slides that sort of summarize sort of where we are with respect to our response in the district. And I would begin on slide 11 if you have it in front of you. I think what the major challenges that we found in DC with respect to our frontline workers can really be grouped into a number of areas. At the beginning of the pandemic, there was a pretty severe shortage of personal protective equipment, and this created some alarm amongst the workers. And of course, worried about the fact that they could get infected by a disease at that time, at which very little was known about the long-term implications and possible effects, other than it could make you really sick and potentially kill you. We found that there were some significant problems with unpredictable work schedules, primarily due to worker attrition, because in some cases we were finding that we had to quarantine many of the workers who were exposed. At one point we took the position that if you were exposed knowingly, you should quarantine, but that created such a loss in workers that we had to basically say, if you're exposed, let's make sure you get tested, and unless you feel sick, we would ask that you continue to work. And there was also a potential loss of wages, not just due to the forced quarantine, but also we were finding that patient utilization was dropping dramatically, and for some workers, the demand for their services began to drop because people were afraid to show up for medical assistance. There was also a lot of the workers, frontline workers, faced tremendous difficulty securing reliable child care and transportation. So you can imagine, you have to go to work, and you have kids to take care of, and your bus route or the time that your subway train typically runs are dramatically altered. You come to work, you have to work overtime, and you realize that when you get off, the train is no longer running. So we had to deal with all those issues. And how do we respond? I would jump you to slide 15. If Melanie, you could take them to slide 15. The first thing we wanted to do was basically set some guidance to answer some of the questions. We were getting a myriad of questions from healthcare providers, particular workers. You know, I was getting calls 24/7 about what do I do in this situation, what do I do in that situation. And so DC Health played an excellent role in laying out and promulgating some guidance, including the imposition of restrictions on the operations of long-term care facilities, governing how they dine, how they handle visitation, resident travel, and the use of non-medical personnel. They outlined prevention measures that could effectively control viral spread, particularly in congregate settings, because if you, as other slides in this document show when you review it, the case facility death rate was certainly the highest for people who were in congregate settings. The guidance also laid out new testing and patient management and reporting requirements for residents. We wanted to make sure that we were being very transparent about where the infections were and who was getting sick. And so both the public and our workers on the front line would understand exactly what they were faced with in the facilities they were working. And the guidance was adjusted based on whether or not a facility was experiencing a high transmission rate or a low transmission rate. And we adopted screening procedures for residents that were customized for the type of facility in which the service was being provided. And probably one of the most important things we did was we stepped up screening procedures for frontline workers, pushing them to the front of the line with respect to not only the frequency with which they would be tested, but also we changed the nature of their screenings. And if you go to slide 18, you will see that the district took some fairly critical steps in expanding testing capacity beyond just a public laboratory and LabCorp. We set up mobile testing sites. We set up sites in each ward, and we then use that information to communicate to our frontline workers where they should get tested. In one situation at St. Elizabeth's Hospital, we were testing the entire workforce 2 days a week, and based on the results of those tests, procedures were adopted to adjust the workforce where needed, depending on whether or not we found, infection. So that was probably one of the most important things we did to ease some of the concerns that the workers were experiencing very early in the pandemic. If you go to slide 19, another major change that we executed in the district, particularly as it relates to Medicaid, was that we took significant steps where possible to minimize the in-person contact between frontline workers and persons who are needing medical attention. And we did this by expanding the use of telehealth and audio-only telehealth. If you look at that chart on slide 19, you can see that in January 20th, just based on the number of beneficiaries in Medicaid, just over 1,300 were receiving services through telehealth. And that generally was not in their home. We had to go to a separate site, not the clinic or the hospital, but a separate designated site. We changed this and we said you can have telehealth in your home, and it could be audio or telehealth. And if you looked at April 20th, by April 20th, we had almost 25,000 Medicaid beneficiaries receiving telehealth, and 95% of the paid telehealth claims were for services that were delivered in the home. In terms of the number of claims, they went from just 1,400 claims in January of 20 to nearly 75,000 by April of 20. If you go to slide 20, we also wanted to try to take some steps to ease worker attrition by relaxing some of the requirements that would allow you that you ordinarily would have to meet before you could start providing services in the district. There's a list of those. I won't go through all of them. There's a list on slide 20 of some of the things that we waived. And the goal again here was to make sure that we were removing as many barriers as we could possibly remove without running afoul of even the relaxed federal regulations. to make sure that we had ample strategies in place to combat worker attrition. One of the things that we particularly focused on were in places where they have stringent nurse-staff ratios, we relaxed those to accommodate labor shortages. And we encourage the facilities to monitor the efforts to make sure that we weren't compromising our quality of care. Finally, I close by drawing your attention to the last slide 23. Clearly, one of the most important issues we had to address was the need to enhance payments for frontline workers. And this is especially important for nurses, assistants, and personal care workers. Through higher wage rates, payments for overtime, these are enhanced supplemental payments. We gave increased reimbursement fees for providers to address their rising costs. And we also provided some retainer payments to providers who were beginning to see their patient utilization drop to such a level that they had to close. We did all these things in the process of stabilizing the system to ensure that once things return to normal, that we would have a reliable system of workers still in place to handle what we figured would be a long time fight with this pandemic. So we think with all these steps that we've taken, we have successfully addressed a lot of the major concerns of the frontline workers. We have been as flexible as we need to be to ensure that some of the problems that they face are being addressed. We've enhanced the amount of revenue or dollars that are going to their pockets to help them with some of the challenges they face in continuing to work during the pandemic. And we think we financially stabilized the entire system in the process. So with that concludes my opening remarks. And I do thank you for attending this important program, and I wish you much success.
Well, Wayne, thank you very much. It's really a tribute to you and your office to see how aggressive and yet how flexible you all have been during this time. Every day, of course, you're facing new information and new challenges, and it's really remarkable to see how well the district has done in terms of working at each level, on the policy level, and also looking at the needs of the direct workforce supply. So congratulations, and thank you for being with us today.
Thank you for having me.
You bet. You have a lot to do. There's more to do, and we look forward to seeing you again. It's been terrific. Thank you.
Thank you.
The next hour will be spent in a panel discussion, which will take us to some of the direct service individuals who have been working on this in the stressful 6 months. So we're going to be talking to CNAs and GNAs about the whole aspect of what they've encountered during their time and how they've survived, and maybe some insights into how best to look forward to the next 6 months or a year. The moderator for our next hour will be Dr. Charlene Brown. I met Charlene maybe 4 or 5 years ago and found her to be extremely experienced, engaging, but very focused on the whole world of direct services. Charlene was a chemical engineer as an undergraduate, went on to Harvard Medical School, is a board certified physician, but also has another degree as master's in public health. And her interest really has shifted into public policy and public health. She was born and raised in New York and has in her family a number of caregivers and nurses. So she knows from her own personal experience what the life is like, and she's directed her experience and her interest and talents now into trying to help. Currently, she is the founder of the CNA Simulations virtual reality service, which is building a virtual reality clinical simulations so that CNAs and home health aides and GNA training programs can reach out and teach clinical skills during the pandemic. This will be a fascinating and new platform, and I think will be embraced by the community, the educational community throughout the country. So Charlene is going to take over as moderator for the next hour with her experience and her interest. Charlene, thank you for doing this.
Thank you, Dr. Leahy. It's a pleasure to be here, and I'm thrilled to moderate this session and welcome a panel of incredible people. Before we do that, I'm going to review some housekeeping. So we're having 4 panelists. If you have questions during their presentations, I'd like you to enter them into the Q&A section at the bottom right hand of your Zoom screen. And once all 4 have completed their presentations, then we will go through audience questions. So to set the stage for this panel, one has to talk a little bit about what has happened with the COVID-19 pandemic. It's hit the long-term care industry by storm. It has wrought havoc on the death of elders. We have 8 out of 10 people who have died from COVID-19 over the age of 65. It has revealed deep and disturbing racial health disparities, with nursing homes that have more majority Black residents have much higher death rates. The majority of deaths have been among Black people in this country. We have so many challenges with healthcare workers and home care workers and nursing assistants. All of the frontline workers in this pandemic are struggling with all kinds of challenges that we'll hear about. There are anecdotal reports of employer abuses, threats of being fired, shortages of PPE. In some cases, home care agencies don't force caregivers to buy their own supplies. Like there are all kinds of anecdotal stories going around about what's happening in the pandemic. At the same time, we have employers who are struggling with shortages of workers and trying to keep their residents safe. So it's in that context in Maryland and DC that we're really gonna dive into this incredible panel. We have 2 frontline workers, 2 direct care workers who will be joining us, and 2 representatives of the long-term care industry. So first, I'd like to introduce Charlene Thomas. Ms. Thomas, why don't you get started with a very brief introduction of your background, what kind of work you've been doing, and some of your experiences during the pandemic. But before you do that, I just want to make sure everyone knows who's coming. So we have Charlene Thomas, we have Sharnette Williams, who's also a nursing assistant. We have Kevin Heffner, who's the CEO of LifeSpanNetwork, a trade association for long-term care providers in Maryland. And we have Allison Siborowski, who's the CEO of Leading Age Maryland, also a trade association for nonprofit long-term care organizations in Maryland. And so let's get started with Ms. Thomas. We're excited to have you. Ms. Thomas is a geriatric nursing assistant and our first panelist.
Good morning, Dr. Brown. My name is Bernie Rakoviak. I'm the administrator at Multi Medical Center.
Okay.
And I want to take this opportunity to introduce Charlene. We've worked together for 10 years, but she's been there for almost 17. We're a skilled nursing facility in Towson, Maryland, just outside of Baltimore, 118 beds with a 28-bed ventilator unit. So we've enjoyed a 5-star rating for some time now. And it's because of the work that Charlene and the nurses do at Multi-Med. With that being said, our business has been turned upside down, as was mentioned earlier. Our occupancy went from 111 to 90, seems like almost overnight because of the COVID fears and related issues. So
thank you for providing that context. It's actually, I didn't know that.
Yeah.
Does Ms. Thomas, is she a GNA at your facility?
She is, yes. She's been at this facility for 17 years now.
Okay.
So having her on the panel would be great. She can give us some updates on what it feels like to actually work one-on-one on the units and all the different things that we've had to institute since March.
Wonderful.
So,
let's turn it over to Ms. Thomas. Thank you so much for that context.
Go ahead.
Ms. Thomas, you have the floor.
Okay, hi, good morning. I'm Charlene Thomas. As Bernie said, I'm a GNA here at Multi Medical in Towson. I've been working here for 17 years. And it has been stressful as far as everything since COVID has started, since back in March. But we're, like you say, like we're doing well. And for me, myself, adjusting, all of us having to adjust to the new norm. It's been very hard, but with prayer, you know, you come in, you put a smile on your face, and you just try to take a deep breath and make the best of it.
Ms. Thomas, that is wonderful, but could you spend a few minutes just telling us about yourself? Like, how long have you been working as a GNA? Have you only worked in long-term care settings? Tell us a little bit about you. We care about understanding you, and then that will help us to also appreciate some of what you're sharing about your experiences working during the pandemic, providing this life-saving work to so many people.
Yes, like I said, again, I've been here for 17 years. I went through the GNA class, and I've been here ever since. And I work on the vent unit, and it's a lot. Having to deal with the different everything, far as like, you know, patients can't have visitors no more. So we're their everything. We have, you know, we do everything for them, but we have to make sure they're taken care of proper. We have to, we have to wear the PPE. So we have to adjust to wearing our PPE all day.
Tell about your personal life.
Family. I have 2 children myself. I'm sorry. I have 2 kids. I'm a grandmother. My children are 27 and 16, and I have a 2-year-old granddaughter. So having to deal with the stress at work and then also deal with the things at home is very hard, but you know, I'm maintaining.
Wonderful. Why don't we take a moment and shift to the next panelist, but I'm actually going to come back to you, Ms. Thomas, and I'm going to invite you to think about a few things
Okay.
that you can talk about when we return to you. First, I'd like you to talk about, there was a study out of New York that interviewed a series of direct care workers, and the study talked about how almost everyone they talked to experienced a lot of anxiety, a lot of stress, because not only were they worried about the residents in their care, but they were worried about themselves. And there were anxieties about bringing the virus home to family. There were concerns about contracting the disease themselves. I mean, there's this question of anxiety, and I'd love for you to speak to what you saw among your coworkers who are direct care workers, what you might have experienced yourself, whether or not you had resources or outlets or community, whether that community was at work or outside of work, to support you through that. And I want you to be able to just speak representing yourself, not so much representing Genesis, even though it looks like your colleagues are surrounding you. And so let's take a pause. Why don't you think about some of the things the insights that you have as an expert, you are the expert as a direct care worker, and then I'll come back to you for you to share some of that with us, okay?
Turn off your video, yep.
So now let's, and why don't you go on mute while we do that, Ms. Thomas? Thank you so much. All right, we have another panelist who I'm excited to introduce. We have Sharnette Williams. Sharnette Williams was having some difficulties with connecting earlier. Let's find out if that has been solved. David or Sharnette, are either of you connected?
Hi, I'm connected as well, and I think Sharnette Morris is also connected under my name, under the other David Rodwin here, because I forwarded her the link, so I'm sorry for the confusion there. I wonder if it's possible to unmute the other, oh, there we are. Can you hear us, Sharnette?
Yes, I can hear you.
Wonderful.
Okay, great, and do you want to turn on your video if that's okay? Up to you.
There you go.
There we go. Hi, good morning.
Good morning.
And I'll let Charlene take it from here.
Okay.
And so Sharnette Williams is a last minute trooper. She's the substitute for the previously registered speaker, Denise Vaughn, who had a medical emergency. She wasn't able to join us. So Sharnette is coming to the table fresh. She has not, I'm gonna explain to you what we're doing here. We're having a panel of frontline workers and employer representatives talking about what it's been like working during this pandemic and what it's like as a direct care worker. Personally, I'd like you to speak as yourself, as an expert. You have expertise at providing care during the pandemic. What are the things that you want everyone else to know so that together we can do a better job of supporting and providing the kind of environment and context that will enable you and other direct care workers to thrive while working during such perilous times?
Well,
And tell us about yourself as well, a little bit just about yourself and what kind of work you do, what settings, and so on.
okay. Well, I'm a home health aide, and I do private duty work at people's houses. And I was working a lot before the pandemic came. So they don't pay us good, and they haven't been paying us good since the pandemic been here. So sometimes I take on extra work and do call outs, and sometimes I don't. Ever since this corona came, I don't have any kids, but I take care of my great nephew, so I don't want to bring it in the house to him.
Yes.
So it's just been hard because you're trying to stay safe for your own self, and you still have to go out and take care of people. And I don't think, like, they don't understand that you don't want to be outside too much. So I try to just get out like 3 to 4 days a week to take care of the people I need to take care of, because I still need to make sure that I'm staying healthy my own self.
I'm glad that you're able to do that because your work is really important. Do you work in private duty independently or through home care agencies?
Through home care agencies.
Okay. You don't need to name the agencies unless you want to, but could you tell us a little bit about how home care agencies have or have not been supporting direct care workers?
They have not. They have not. They have not. They haven't did anything. They haven't paid us no hazardous pay, and they haven't provided us no PPE equipment. They haven't been doing nothing. It's just the same way it been ever since I first started this job 13 years ago. Nothing. They don't. The agencies that you work through, they don't care. They don't care about you. They mess your checks up and everything. And it's just, I'm ready to get out of the health aid field. I like doing this job, taking care of older people, but I'm ready to just do something else and to stand out on my own instead of having to work through the agency.
I hear you. I was reading in an online discussion group among CNAs and home health aides that there were a lot of agencies that weren't supplying PPE and expected workers to go out and buy their own. It sounds like that happened to you.
Yes. Yes, it's the same. I bought a whole bunch of masks. I got me a whole bunch of masks. They go my gloves here. I got my own gloves and I got my own mask to go. One mask that I got right here so far. I got about 3 or 4 of these kind of masks right here. So I just had to go out and get my own thing so I can make sure that I'm safe for my own self.
Well, right now you have the ear of a whole bunch of people who work in long-term care, both home care and nursing homes. And I want you to give them 3 things that they can do to take better care of their workforce during this incredibly difficult time. What are the top 3 things that employers should be doing to make things better?
Well, I think that, so far, when you come in, you talking about working in the facility or the kind of work that I do?
You should speak to the kind of work that you do because that's where your expertise is. So tell us about your work and what are the 3 things that employers should be doing to be better employers during this unprecedented pandemic?
Okay. Well, I think, first of all, that they should be providing us with the PPE equipment. And I also think that they should be paying us hazardous pay. Because even though we're not in facilities, we're going to people's homes, we're still putting ourselves in jeopardy because some of us don't have cars and we have to catch the bus. Like, I'm a person that used the MTA. I catch the bus, I catch the subway to some of the clients' houses. So they're not paying us right. And I think that they should be offering us either bonuses or giving us a $2 or $3 raise and applying us this equipment, because they still call you and want you to come out and go to work, but they're not providing anything extra for you.
That is terrible. You mentioned wanting to leave home care or leave the industry altogether. Is it the pandemic?
No, just home care.
Just home care? Tell us
I just want to leave the home health aid. I just want to leave the home health aid field because, like everybody else know that's inside of the home health field, the agencies, they don't pay us right. They don't pay us right. I'm leaving the agency now. That thing that is fine for them to mess up my paycheck. I just was into something with them 2 weeks ago. Like 2 weeks ago about a paycheck that was messed up. So when I got my paycheck again this 2 weeks, the same problem, check messed up. So now I'm about to just leave and put my client to another agency, but I'm looking into doing something else because I actually don't have a CNA GNA. I'm a CMT.
well, CMTs matter as well. And so what are when you say that you want to leave home care, did the pandemic contribute to your decision to leave home care, or were you already planning to leave? And what's next for you?
I was already planning to leave home health aid because the agencies, they doesn't pay you right. And that's just like a whole headache. So I'm ready. If I can do home health aid so I can get paid on my own without having to work through an agency, then I can stay. But while the agencies got to be involved in it, I'm leaving. I'm go online and do this class through Ellsworth College. It's a medicine aid class, so I want to just only pass out medicine right now. So with my CMT, I can only do certain, go to certain places. But if I get the medicine aid with the CMT, then I can go work places and where I want to work and pass out medicine.
Okay, that sounds like a great plan. I'm going to ask you one more question, and then I'm going to move on to the next panelist. But do you have anything you'd like to add about life during the pandemic as a CMT working in home care? Tell us about the rest of your life. Do you have family? Do you have loved ones who've been affected by the virus? How has it been as a human being who works in home care living during this time?
Well, it been when it first started, it was rough because I didn't know what was going on and they know too much about it. So it had me scared. But now since they've been going on and they've been talking about how to be safe and careful and stuff like that, it's much better for me because now I'm starting to do call-outs again for my work. So you just got to make sure that you be careful. And if you got to buy your own mask, gloves, or whatever else you need to put on, just buy it. Because it's better to be safe than sorry. And far as in the pandemic, I have lost, I know about 6 people that have lost their life from the pandemic that I know, but there's only one of them that I was real close with that lost their life since this been out.
I'm so sorry for your loss. That's terrible. Sharnette, thank you so much for taking the time on very short notice to share some of your journey with us. I'd like you to stay on the line, just mute yourself, and we're going to circle back to you during the Q&A, but I'm going to move on to the next speaker. Again, I really appreciate you being so transparent, honest, and being very clear about the importance of better pay, particularly hazard pay, safety equipment, because that is actually legally required. And third, the importance of education. It sounds like there wasn't necessarily enough education around what the pandemic was and what it meant by your employers.
Right.
So thank you for sharing that. We're going to move on now to Kevin Heffner, the CEO of LifeSpanNetwork. I've known Kevin for many years and I'm a big fan. Kevin, are you here? And would you like to not only give us a few minutes, like maybe 1 minute, about your esteemed background, and then help us understand the employer perspective during this pandemic, specifically the employers that LifeSpanNetwork represents?
Sure. Well, great. Thanks, Charlene. It has been a pleasure to be part of this program and to listen to direct care workers who are living this every day. It's very insightful and helpful to us as we plan our next priorities. One of the things that you asked me to do is a brief background. I'll just tell you that I've been doing this for a while, and I got into this field the same reason that many of us do, because I care about older adults. And so Lifespan is an association of all sorts of senior service providers, ranging from nursing homes to assisted living facilities to retirement communities, life plan communities, home health agencies, hospice, and even some adult day and hospital members. So very, very pleased to be part of the collaborative and part of this conversation. I will tell you, you know, it's no surprise to anyone. This is a problem and a challenge that has existed for a long time. And I've shared this anecdote before, but a couple of years ago, we moved our offices, and as often the case when you move, you find things that you forgot about. And we found during the course of moving a member survey from 1989, 31 years ago. The biggest challenge that providers identified in 1989 was direct care workforce. And so 31 plus years later, here we are, we need to adopt some aggressive measures to be able to manage some of the challenges, which have only been exacerbated by COVID. There have been a few silver linings for us collectively in this experience, even in senior services. One of them has been the creation of alliances between associations. HFAM, Leading Age Maryland, and Lifespan have worked together closely on a number of fronts, but most notably, two things that I'll mention: PPE and testing, where we have worked together to, if you remember back in March, the trash bags that we were seeing in New York, and we collectively worked together to pull in the same direction and to leverage resources domestically to be able to get PPE to providers more quickly without having to go through customs. And we're still doing that. And the three associations have banded together to really do, I think, some important work in getting PPE prices down and getting the PPE that providers need for frontline caregivers to them. And also knowing that the PPE that we're getting them can be trusted, that it meets FDA certification measures, et cetera. The other area, testing, we're in the midst of right now, in the shift from PCR testing to POC testing in Maryland. Having conversations every day with the Department of Health on those things.
I'm just going to interrupt you and remind you about acronyms. POC.
Oh, sure. Sure.
All these words, what do they mean?
Sure. So up until just recently, the way that testing takes place is that test kits are dropped off with providers. They are then have staff and residents tested by nurses. They're then picked up, they're tested, and sent back from labs. The results are sent back. POC is point of care, where providers are able to actually do the testing themselves. And so machines are being delivered now by the federal government and privately to speed up the testing process and to make it more affordable. So we're advocating in those areas, again, to make life a little bit easier for direct caregivers as well as for provider organizations. But I want to talk just briefly about what I think is one of the most important initiatives that we're doing. You know, in a pandemic environment, innovation springs to the fore. And so as a result of need, we have looked at ways to remove barriers for caregivers to get into the field. You know, we heard directly from caregivers about the burdens and the challenges that they face every day. Well, one of the ways that we may be able to get more caregivers into the workforce is by removing barriers. Specifically, we've been working on developing a fully online GNA CNA certification program. And with our partners, HFAM, Leading Age Maryland, we've been working with the Maryland Higher Education Commission, or MHEC, and the Maryland Board of Nursing in order to put that in place. We've also, thanks to Dr. Brown, been connected to Howard Community College, which has the only online certification program in Maryland, obviously not available freely to residents who live in other areas of the state of Maryland. So what we've done is partnered with a company named Relias, which has 28, operates in 28 other states, has online certification programs already in place. We have worked with, and I know that Mike DiGiacomo is with us today. I'm part of the Governor's Workforce Development Board on some innovative ways to try to do what I think we can all agree is important, to get people who have been separated, who have lost their jobs in service industries such as hotels, restaurants, and to get them into a field that needs them desperately. But some of the barriers that exist to being able to do that include transportation issues. Can't get to the local community college's certification program. The scheduling doesn't work. Daycare is a challenge. And so having an online program that can be done either synchronously or asynchronously will enable more people to get into the field. And with the cooperation not only of Mike and Secretary of Labor, Tiffany Robinson, and their support of some of these kinds of ideas, to use some resources within the state to encourage people who don't have jobs to look at nursing as an opportunity to get into a field that desperately needs them. So just a couple of things that we're working on. I think the online CNA GNA program is among the most exciting things that I've ever been part of. We continue to work with the Board of Nursing, with MHEC, in order to get it stood up. But I'm
going to interrupt you just because of the time. And because I'm a big fan of the work you're doing at Lifespan, but I want to make sure you don't run out of time to be able to comment on some of the ways that employers can respond to some of the challenges that you're hearing from the direct care workers on this panel, speaking to what you've heard from employers about how they're trying to or not trying to support their workforce.
Well, I think the providers that we represent, are financially pressed more now than they've ever been. They're very sympathetic and supportive of minimum wage increases so that direct care workers can be better compensated. I've heard lots of really creative ideas over the past 25 years about things that providers are doing to create a culture that honors caregivers, that makes them feel as they should, that they're doing noble work, and they should continue to do that. But financial stress is a real pain point for providers, and trying to find those extra dollars when you're having to pay for PPE that you've not budgeted for, when you're having to pay for testing that you've not budgeted for, and when you're having to pay hazard duty and surge pay for existing nurses, it's a real challenge.
Okay, well, on that note, we are going to turn it over. Thank you, Kevin, for that context. To Allison Sabrowski from Leading Age Maryland. Kevin, could you go on mute? And again, anyone who has questions for Kevin, Charlene, or Sharnette, please make sure you're adding them to the Q&A, because we're going to go rapid fire through the questions when that time comes. But now we're excited to hear from Allison Sabrowski from Leading Age Maryland. And please be sure when you're telling us about, as a representative of the nonprofit long-term care providers of the state of Maryland, please be sure to address some of the concerns that we heard from Charlene and Sharnette in your comments.
Yeah, Charlene, thanks so much. We are so glad to be part of this conversation today, and glad to see the growth of the collaborative over the last few years. We've been involved since the beginning, and it's just great to continue work with you all, so thank you. Leading Age Maryland, so we represent nonprofit aging services providers in the state. So similar to Lifespan, we have members that range from life plan communities, nursing homes, affordable senior housing, community-based organizations, hospice, so a wide range of provider types. And I'm not going to repeat any of the challenges that have been shared by others on the call today. We are all well aware of the difficulties that we have faced during this time. I'm going to share a bit about, I'm going to touch on the finance piece, because I know that pay and the financial burden that many providers are facing is a huge challenge. And I heard that from the direct care workers that shared on the call today. And then I'm really going to focus the bulk of what I share on this kind of psychological burden, anxiety, and mental health piece that we know is such a challenge and something that organizations really need to be prepared to address in the future. So just a note about the financial piece, so if you look at the numbers, long-term care residents and workers account for roughly 40% of all COVID-related deaths in the US. So it's a huge bulk of where we've seen the virus. And yet if you look at the relief funds that have gone out, 90 billion in relief funds went to hospitals and only 10 billion went to nursing homes. And not even all 10 billion of that, not even all of that money has yet been dispersed. So there's just a huge inequity in how we've kind of prioritized older adults in our society. That's not a new challenge. It's an existing challenge, but I think that we're just seeing a lot of these same challenges magnified because of the urgency of need during this time. So one of the ways that at Leading Age Maryland, we are really trying to work to support our members is to help them think about the trauma, stress, and anxiety that the workforce is facing right now and how they can care for their most vital asset and part of their team, which is our workers. And so we've looked at some surveys. We've completed some surveys with our members to really ask staff members, direct workers, frontline managers throughout the organization to kind of see what are really the top stressors that folks are facing. And this is not a surprise to anyone, and it's echoed by those who have shared on the call already today, but really a lot of the top stressors that we're hearing from our frontline folks is seeing the emotional pain that residents and loved ones are feeling because of visitation restrictions. We all go into this field because we care about people. And seeing that pain of having to keep loved ones and residents separated is tremendous and can't be underrated. And then, as others have noted on the call, the anxiety of, am I going to get this virus? Am I going to take this back to the children or grandchildren or family members that are in my home that I'm caring for? Not knowing if you're positive or not when you're waiting for test results was noted as a top stressor. And then just experiencing and hearing about all of the loss and the fear of losing loved ones and residents is real. Some of the staff we spoke to also noted just this feeling of being trapped, like you just can't do enough. We don't know when this is going to end. There is so much uncertainty. And then some of the really big stressors were lack of support and recognition from leaders and from their organizations. And a lot of different examples were given. And then also just the larger political, racial, and societal stressors that we're seeing right now as well. And then just managing all of the new challenges at home and kind of exacerbation of challenges that were maybe there and are just more apparent now. So, that is just kind of a snapshot, and I'm sure is not a surprise to any of us. That those are some of the top stressors we're seeing, but we're really trying to look at how can we prepare organizations to care well for their workforce in a very practical way. So we've partnered with a mental health provider in this state, and we're working on developing kind of a toolkit, if you will, of here's the state of mental health of direct providers in Maryland. Here's what we know the challenges are, here's what already exists, and here's recommendations for how we can do more. And so you may know that the Maryland Institute for Emergency Medical Services Systems and the Behavioral Health Administration in Maryland put together some mental health services that are available for free. So it's counseling, education, anyone can request services if they work in a long-term care facility or other healthcare setting. I touched base with them yesterday. Only 30 nursing homes out of the more than 200 in the state have reached out. And only 7 assisted livings. So they are just baffled at why folks are not taking advantage of this. And we're really eager to get the word out and let folks know that this is a fully funded program through the end of the year. At this point in time, it's not continuing past then, but this is a free service that either an organization or an individual can reach out and get services. So I really just want to remind folks that that's available. And I can email that, that information directly if it would be helpful to share.
Allison, is that service available to individuals who work in long-term care, or does it have to be through their employer? Can they?
It does not have to be through their employer.
Okay. Well, why don't you make sure we all have that information and we can send it out through our networks?
Yes, I will surely share that. So I just, and I know we're running short on time, but I just wanted to note that, you know, what we know helps is connection. I mean, connection is one of the #1 protective factors against depression and against these negative effects of psychological burden. And so really what we are working on, and what is echoed by what we've heard from staff of what helps, is helping organizations provide clear, consistent, timely, and supportive communication. So I think this was echoed by others on the call, that transparency is important, building trust is important. And then leaders really need to demonstrate understanding and empathy and recognition of the challenges that healthcare workers are facing right now, and really care for them in practical ways. So I think there's many challenges that we're all addressing right now, and it's important that we are continuing to think about what the effects of this are going to be in the months and years to come.
All right, thank you so much. Well, I want to take a moment and thank Charlene, Sharnette, Kevin, and Allison for sharing your perspectives from completely different angles on what some of the priorities are as it relates to employers and direct care workers, with a special attention to how this industry can best support the direct care workers who are providing the hands-on care to older adults during this time when they are so vulnerable to the SARS-CoV-2 virus that is essentially promoting this entire pandemic. Before we switch over to the questions, I'd like to turn back to Charlene Thomas, who was our inaugural speaker, courageous as she was to be the first in the hot seat. Charlene, do you have anything else you'd like to add? I know I gave you a little bit of homework. Let's see what you have to say. And then we're going to switch to questions and answers. Please put your questions in the Q&A section, the bottom right hand of your screen.
Sorry. They call you?
Yes. I'm sorry, Charlene. Okay, I want to talk about as far as like my anxiety, since everything has started, it's been through the roof. But for me personally, I just go and I take a deep breath and I teach myself to count to 10. And my coworkers, you know, everybody is just on edge because we don't know what's going to happen from day to day, second to minute to minute. You know, it's hard.
For 1 second, just ask everybody else to be on mute. I just heard some weird background noise, but keep going. Yes.
Oh, okay. So, you know, we all have to learn how to maneuver and deal with our anxiety and stress in our own little ways, and reach out to each other more, because we're all dealing with this. You know, we can't see our loved ones. We're scared to go outside. We're scared to do this. And because I don't want to get sick, I don't want to take this home to my family. My mom is sick, have health issues. So it's like you put yourself in this bubble, and it's like, I have to adjust to this. So all I can say is, you know, we just have to hang in there the best we can, reach out, talk to each other. That's the only way you're going to get things out. You have to talk, stay educated. And our staff is very good. They keep us educated on everything. And just try to hang in there the best we can. You know, that's all we can do to get through this.
All right, everybody, you heard it. Words of wisdom from Charlene Thomas. Take a breath, hang in there, and thank you for that encouragement. And thank you for sharing some of your experiences and insights. It is that time, everybody. We are flipping it over to the questions and answers. Let's see what's going on. Okay. Maryland is requiring weekly testing for all staff, but has stopped paying for it. That's a problem. This is a serious financial problem. What can be done to get the state to pay for not only the testing, but the overtime required to administer the tests and allowed to work? I have a feeling that is beyond the scope of this panel, but I will put it out there to see if Kevin or Allison have some insights about how to get the state to pay for things that it is no longer paying for. See, silence from Kevin and Allison.
No, we're here. I'll let Kevin go first.
Well, I think we've been working together on this every day for the past several months. It's obviously a great concern to providers. As I mentioned previously, adding the cost of testing to the PPE cost to the cost of hazard duty for nurses. And it's certainly not sustainable. We've expressed that to the state. We've also encouraged the state to do everything that it can to get the dollars that have been pledged by the federal government into the hands of providers that have been part of the stimulus packages. We're, trying to get financial relief there as quickly as we possibly can and continue to lobby the state for more dollars to be accessible. But as you know, as everyone has heard, the state is in its own financial crisis, and so it's a challenge. Allison, anything I've left out?
No, I would just echo all of that, and that we are, we recognize what a challenge it is, and it's a daily conversation. And I would just say that we are working to do all we can to address that.
Okay, thank you both for that comment. Great, Gail is going to look into collaboration among acute and long-term care providers in DC. And she's asking a question that's near and dear to my heart. In DC, we are focused on virtual learning as well. Has Maryland sorted out how newly trained prospective workers can obtain clinical testing virtually? Do you mean clinical, do you mean the, I'm just gonna see if do you mean clinical rotations or the Pearson VUE clinical testing, Gail? Maybe you could write a little extra comment so we can clarify your question. In the meantime, we'll go ahead to the next question while Gail adds a little bit of additional information. Allison, on visitation policies, can you share recent conversations you have had with the Maryland Department on this? Whether indoor visitation is on their radar screen, whether you are encouraging your providers to invest more in rapid turnaround testing to more quickly understand the status of workers coming in and out of facilities daily. So that we can get more secure facilities and more visitation. So the questions for you, Allison, on when can families come in and what's up with the testing? How can we get more testing? More rapid turnaround?
Those are the million-dollar questions. I can tell you that Kevin and I and our colleague Joe DeMattis at HFAM are all intimately involved in trying to help solve these problems. We're glad to see that outdoor visitation and some other flexibilities have been allowed, but there's still so much work to be done. I don't think any of us thought that this far into the year that there would still be residents that were not able to spend time with their loved ones. And so we have, there's other states that have done really creative things around visitation, especially for individuals who have dementia or really have high levels of need to have that family connection in a more regular way, and maybe aren't able to do so through technology. So I would just say that it's something we're working on. I wish that I could give a more firm answer, but there are so many challenges with being able to track this virus. When I speak with members, they would like nothing more than be able to open up their doors and welcome family members in to visit. But the challenge is there's still just so much unknown around having enough testing, having enough PPE, and really being sure that when we're letting people in, it's not putting others at risk. So I would say we're hopeful that the point of care devices that are being distributed by CMS will allow for really helping us beef up the testing that's being done and make it more available, and the rapid results will be helpful. But there's just a lot more work that needs to be done. And I wish I could give a solid answer, but that's where we are. Okay, thank you, Allison. We have a clarification from Gail Cohn. So she was basically asking about clinical testing by Pearson VUE, which is a national testing provider for many things, including CNAs and GNAs. So Pearson VUE just offered virtual clinical testing for newly trained home health workers. That was a big change because DC had a bottleneck with students who finished their coursework but could not be tested. So the question is, what's happening in Maryland, and are Maryland's newly trained CNAs or GNAs able to obtain testing from Pearson VUE virtually? Kevin, do you know the answer to that?
I don't. I do know that built into our strategy for the online program and certification and testing, that there are some protocols in place that the state seems to be satisfied with for them to be able to do virtual testing. You know, they were concerned about security, making sure that the person who appears to be taking the test is the person who's actually taking the test, et cetera. And so they've been satisfied with the answers we've given with Relias.
Okay, and I did a quick Google search. Apparently Pearson VUE is also offering GNA testing. It appears to be offering GNA testing in Maryland. Everyone has to wear a mask and they have some parameters to be followed. Also, just to take a moment and I'll put a link to CNA Simulations VR in the chat, which is a way of also not doing your clinicals, like being safe while doing clinicals as well. So I have a question for Sharnette Thomas over here in the chat. So this one is for Sharnette Morris. And Sharnette, I am so sorry for butchering your name earlier. I kept calling you Sharnette Williams, but your name is Sharnette Morris. Have your employers or the government given you any training about how to protect yourself, your family, those you care for during the pandemic, or have you been left to learn it on your own? Sharnette, could you take a moment and jump in with an answer?
Yes. Can you hear me?
Yes, we can hear you loud and clear.
Okay. One of my agencies, I work for 4 agencies. One agency actually, they sent me a list of things that I should be doing and I should be weighing. But that was only one agency out of the 4 that I worked for. The other 4, they didn't send anything.
Got it. That is disturbing. Did they bring up the pandemic at all? Like, did it come up in conversation?
No.
Did it,
the only thing that I received from the agencies that I work for is a letter stating that if I was to get stopped outside, to let them know that I was a worker that I could be working in the pandemic. That's the only thing that all the agencies sent me. The one agency that I'm currently working for now is the one agency that I do the call outs for. She the only one that texts me a message about wearing my gloves and wearing masks and having hand sanitizers. But she didn't buy it. She just was telling me that that's what I needed to have.
So no budget to supply PPE, and all 4 home care agencies that you work for in Maryland or DC expect you to supply your own PPE and your own hand sanitizer. I just want to be clear that that's what you're saying.
Yes, that's what I'm saying. That I had to supply my own gloves. There they go, right there. I showed you my mask. I got my hand sanitizer inside of my bag. So when I leave out, I always make sure I buy hand sanitizer and I buy the wipes. I buy, the little packs of wipes. I go to the Dollar Tree so I can make sure I buy a lot because they're $1. They work good.
So why don't we take a moment and just reflect on what that means for our essential workforce, our essential worker here to have to supply her own PPE while being employed as an employee by 4 different employers in our region. It's not acceptable. I'd love to invite Kevin or Allison to comment on strategies that we can collectively take to help our industries to do a better job of providing the kind of support and OSHA mandated supplies that keep workers safe while at work. Whoever wants to go first, Allison or Kevin.
One of the things that we've been doing is to share information on donning and doffing, share information on how to get the most affordable PPE. We're somewhat limited in terms of what we can actually do, although I would say we have a supply of PPE here. If you're not getting it and you're a frontline worker, you come here and we'll supply it to you free of charge.
That's good to know, actually. Why don't you make sure we all have that information and we can spread the word that, are you saying that direct care workers can come to Lifespan and get free supplies? Is that what?
Yeah, so if there are individual direct care workers, I was talking about our panelists today, but if there are individual direct care workers who are having to risk their own health and safety by going out into the field without proper PPE, we'll do that on a case-by-case basis. We can't provide blanket, thousands of pieces free of charge because we've paid for it. But I will say that, you know, in these kinds of individual cases, we can provide it in a stopgap, as a stopgap measure. But that's not a long-term solution. The long-term solution is for providers to understand their responsibilities better, or more directly to carry out their responsibilities.
That makes a lot of sense, and that's a very generous offer. We're going to spread that far and wide. Allison, anything to add?
Yeah, I think just echo what Kevin says. I think that we just all need to continue to be advocating for a sustainable solution to long-term services and supports for older adults. I think there's just so many gaps in funding, which have that trickle-down effect of not getting the right resources in the hands of those who need them most, our direct service workers. And so I think that just continues to be so abundantly important.
Absolutely. Okay, let's go back to the Q&A and see what's been happening there. Let's see. All right, well, I have some additional questions, and I really want this discussion to focus on the needs and gaps that are faced by direct care workers across settings, home care and facility-based care. I know that, Charlene, I know that it's difficult for you, well, it's not difficult for you, but that you are sitting at your employer in your employer's office with your supervisory structure right around you. So all I'll ask you to do is comment on any colleagues that you may know at other facilities that have talked about any challenges they may have experienced during the pandemic that can help the audience to better understand some of the idiosyncrasies of working as a direct care worker during the pandemic in facilities. We heard a lot of really great information from Sharnette that should challenge us to do better. I'd love to know what you've heard from your colleagues and friends who work elsewhere about some of the challenges that they have faced.
One friend that I have, she quit because she have health issues and she didn't feel safe. She did like home care too, didn't feel safe going from house to house, and they didn't hurt where she worked. They didn't provide PPE for them too. My other friends that I have that work in a healthcare facility, a lot of them are complaining that they don't have proper PPE and they don't feel safe. I have a niece who was like, I'm not going in because they don't have the proper PPE to go to work. So that has been.
Is that happening now, or was that what was happening?
It's kind of like when everything kind of like first started. But my one friend, like, she didn't go back at all. And my other friend, everything, it seemed like now things are kind of like calming down a little because everybody is on top of things. Like they having the proper PPE now. So things are getting better than when everything first started because it was like a big rush. So things are calming down. They're getting better as far as the proper PPE equipment and stuff.
That's great to hear. Worker health and safety is essential, important, critical, and knowing that things are improving, at least from what you're hearing in long-term care, is great. It sounds like they're not improving universally, as we heard from Sharnette. And so I want everyone listening today to really internalize what that would mean to be working right now, providing hands-on care to people. Everyone can have the virus, with 40% of people being asymptomatic. I want us to all just take a moment and let that sink in and think about what you can do to help make it better as stakeholders in this industry. We have a final comment or question from Jay Keys. Many people do not know that there are resources for PPE, as well as finding out about free mental health. Knowing what resources are and how to get them is extremely important. So pushing the narrative, excuse me, and banding together to get the federal government, pushing the narrative and banding together to get the federal government to release this money will help the needs of all frontline workers. It sounds like there's a really strong push towards lobbying the government and trying to push to free up resources to further support the ability of employers to keep their workers safe. And so that is in the hands of Kevin and Allison as the trade organizations and the organizations that work with lobbyists to advocate to the state. Do you have any comments on Jay Key's final closing reflections on how to band together to get the government to release this money to help address the needs of frontline workers? All right.
Yeah, I think it's an important point, and one of the things that we've been doing collectively, Leading Age Maryland's lobbyists, as well as HFAMs and ours, have really been working to ensure that the dollars get where they're supposed to go. I think there's been a concern that some of the stimulus funds would be reallocated for things for which they were not intended, as opposed to being provided directly to the organizations that care for older adults so that they can meet their existing needs, not having those dollars earmarked for things that legislators or regulators want them to do with them. Allison?
Yeah, I would just add that, on top of just advocating that these relief funds and stimulus funds are getting to providers, Kevin and Joe and I are really focused on what things might be coming in the next legislative session and what's going to be happening with Medicaid rates in the state, and just really trying to stay proactive and ensure that we're setting providers up for long-term success.
Wonderful. Thank you both. It is 11:15 on the dot, and our panel discussion ends at 11:15. So I'm going to take a moment and deeply and profusely thank all four of our panelists, but I want to do a special thank you to Charlene Thomas and Sharnette Morris for jumping in the hot seat on a panel with a whole bunch of representatives that you don't know, and just talking from the heart and sharing your experiences so that people can build that empathy to start to do what they need to do to help make things better. Kevin and Allison, thank you for standing strong and representing the trade associate, being the representatives of the trade associations that represent the long-term care industry in the state of Maryland. And I am really pleased that you were able to spend some time with us this morning and share all these insights. Again, I'm Dr. Charlene Brown, founder of CNA Simulations VR, but at heart, my career and my training is in preventive medicine and public health. And this is the worst pandemic of my lifetime. And I spent much of my career working on pandemics. And so I'm really heartened by the energy and attention to this issue with the special lens, thinking about the needs of workers. And I'm going to turn this back over to Dr. Leahy to introduce Senator Clarence Lamb, one of my fellow preventive medicine doctors who has entered the political arena. With that, Dr. Leahy, the floor is yours. Thank you, everybody.
Charlene, thanks very much, and thank the panelists for all of their insights. I mean, it was for all of us, I think, extremely rewarding to hear from individuals on a day-to-day basis, the stresses, and even to start to think about and introduce some of the policies that may need to be looked at and addressed quickly as we move into the next phase. We have the great pleasure today of having Senator Clarence Lamb joining us. Dr. Lamb was in 2014 elected to represent Maryland's 12th legislative district, and then 2 years ago he was elected to the Maryland Senate. He continues to work as a physician at Johns Hopkins Medicine, so he brings both the experience as a practicing physician and also an extraordinarily good politician and a statesman looking at policies. He's currently working on the Governor Hogan's working force on pandemic. So this is a wonderful opportunity for Dr. Lamb to conclude our discussion today and to hear maybe some insights into the future and how policy work and the state or the federal government could be of some assistance to try to address the myriad of problems faced today and in the past. So Senator Lamb, thank you for joining us.
Sure, thank you. It's a pleasure to be here, and certainly appreciate that introduction, Dr. Leahy, and also good to see you again, Dr. Brown. A lot going on, obviously, when it comes to public health. Always great to see other public health champions doing good work out there and appreciated your facilitating the prior session too. I was able to catch just a few moments of that towards the end. I'm actually in clinic right now, so have a break in my clinic to be able to come speak to all of you, because this is an important issue that's not only near and dear to all of you, but also for myself too, as a physician, as the only physician in the state Senate, one that we want to continue to highlight and bring forward as something that needs to be addressed and continually needs attention to, as well as all of you know too. And also want to thank Ron Carlson for organizing this, and also extending the invitation to me as well, and to all of his efforts that have occurred over the past 6 months during the pandemic to highlight what's really a core issue here, which is the safety and well-being of our direct service providers, and making sure that there are adequate protections and safeguards and processes and tests and protocols in place, so that all of them and yourselves as well feel comfortable following through with really needed services for our communities. And so, I know it's a challenging time for everyone, particularly those in the healthcare field, to be able to feel safe in their work environment. And particularly for direct service providers, this is no exception. This is a really, really challenging time. And so, I think there are many of us who are concerned about direct service providers and their well-being, because you do provide an essential service as part of our healthcare system. And I think all of you and the providers out there know exactly why. But, particularly as this pandemic wears on, I think it's important to bear in mind that, we're going to need and rely on direct service providers more and more. That inevitably individuals will become sick from COVID. Our hospitals will, face stresses that they've probably never seen. And we're all certainly concerned about what the winter time, particularly with flu coming up, will look like. And the need to be able to decompress hospitals, to transfer patients to the next level of care that's appropriate for them, is really essential. And it's a chain reaction. It's really a chain of sequences of events for a patient to be discharged from the hospital to maybe some type of recovery center or acute care recovery, and then down to other transitions as well, eventually to, to home. And some of these patients will still need help at home too. And, direct service providers are, integral to that chain, functioning well, and being able to allow our hospitals to function at the greatest capacity that's available to them. And so I think it's short-sighted when people lose sight of how important direct service providers are, because as this pandemic wears on, I think the need and the recognition for that need will continue to grow. Obviously, even though it seems like it's been a while that we've been in this pandemic for the last 6 months, it's still early, so to speak. And so we still have a ways to go, and to be able to highlight this issue of concern to officials in the state agencies, department leaders, other elected officials, legislators, is really critical to be able to help grasp the challenges that we see before you. I know through working with some of our advocates and with Ron that we tried to help the direct service provider community earlier this year by reaching out to the Maryland Department of Health and being able to convey some of our concerns and the crucial needs that still lie within this community. We highlighted the need for, I think this was brought up earlier, Medicaid funding, right? That there was an increase of 4% included in the FY21 budget that we're currently in right now, and we need to make sure that that was retained. We also wanted to make sure that benefits that are available and needed for direct service providers are available to them. One of which early on was free childcare that was offered to them. I'm not certain that that's still available now, but I think the department at the time could have done a better job in making direct service providers aware that the service was actually available to them, that DSPs were considered essential workers and would qualify for this benefit. And if this benefit were to return or come back, and the state were to designate, child childcare access for essential workers again, I think we need to make sure that direct service providers are A, included in that, and B, are notified of that as well. We know that all of you are very busy. And so sometimes this awareness is really important so that they find out about these types of benefits or services that are being provided to them. We also wanted to make sure that direct service providers and home care aides have adequate time to train for basic precautions and procedures and processes that are necessary during the COVID pandemic, and really emphasize to the department that that compensation should be offered to direct service providers for the time that they spend in training. That really training is an essential part of being able to go out there and do the work that's needed during COVID. And the time that's taken away from being able to provide those services to do this training is really essential too, and that should be covered and compensated for. We also wanted to improve the amount of testing that's available to direct service providers here in the state, because we know that testing is incredibly important to be able to catch people early, and also to be able to ensure safety of the providers themselves and their families. I think there's still more to come when it comes to improving testing here in the state. We are constantly struggling and prodding the Department of Health in the state and also the federal government to improve testing capacity. And so some strides have been made, but there's still continual ground that needs to be advanced to be able to have testing prevalent throughout our community. And so we're going to continue to work on that, and would appreciate your advocacy too, to make sure that our direct service providers and home health aides and workers also have access to that. The other piece is PPEs. This is obvious, right? We all know that there was a PPE shortage early on. As things have gotten a little bit better, it's been a little more accessible to individuals, but the need for PPEs, especially for providers that are going to people's homes, is incredibly important, right? They're going into unfamiliar territory. They're going into areas where PPEs are critical to be able to maintain their safety, because they may be in close proximity with other family members, and they may have to switch them out frequently, right, if you're going to different locations. And so we are continuing to impress upon the need for MDE, or for MDH, the Department of Health, to coordinate PPE distribution and supplies so that direct service providers and the like are not left out when it comes to ensuring that they have proper PPEs. And then finally, we've encouraged the Maryland Department of Health to seek approval from CMS to provide bonus or hazard pay to home care workers. That this is an unprecedented time, and we know that the challenges that are facing home healthcare workers who are going into these really difficult environments, sometimes unknown, sometimes without much backup, they really need a lot of help. And being able to provide this additional bonus incentive will not only help them be able to continue the work that they're doing, but also ensure that we have adequate capacity within our direct service provider community to be able to continue to provide these services that are really important, as I mentioned at the top, to allow for this critical piece of the healthcare system to continue. And so, I want to make sure that you're aware of those efforts. We are still conducting as much effort as we can in advocating for these types of policies and provisions to support all of you, our frontline workers in this. It's obviously an unprecedented time, obviously a very challenging time, and our heart goes out to all of you, the advocates, the workers themselves, who are doing the hard work out there and making sure that we maintain this critical program and service here in our state, because this is really needed. And as the COVID pandemic wears on, I think this will certainly become all the more apparent, if not already. And so, feel free to reach out to myself and my colleagues in the legislature. I think it may take a little bit of explanation what direct service providers do to those who may not be familiar with the healthcare system or with medical care. But I think once they understand, I think they will recognize the incredible need for these types of services, and why the providers that are conducting these programs are really critical to our healthcare system. So again, want to thank you all. I know you all have busy days, for taking your time out of your day to participate in this conference. Really incredible information that's being and hope that you will continue to advocate on behalf of the community for direct service workers and anything that we can do to help provide additional benefits and provisions to them. You know, we're really championing these efforts to continue to move forward. So feel free to reach out to me. Let me pause here, and I'm happy to hand it over to either Dr. Leahy or to Ron. So thank you again. It's a pleasure to be here to join all of you, and keep up the good work.
Yeah, Senator Lamb, thank you. Thank you very much for taking the time today in the midst of one of your clinical days, but thank you in particularly for what you've outlined to us as what the governor's task force has been doing and what we need to think about going forward. You're at a critical spot being in the state legislature, because obviously from what we've heard today, there's going to need to be an integration of public policy, financial resources, et cetera, to shore up the direct services group. This was a problem, as Kevin Heffner had indicated, 31 years ago, and now with the pandemic, we're into an entire different chapter with more demands and more needs. So thank you for all you've done, and we look forward, all of us, working with you in the future. I want to thank everyone today. I want to thank Deputy Mayor Turnage for his time and his efforts. The district has been working very hard, as we've heard, has been very proactive in terms of policy. Dr. Brown, thank you again for your moderating the panel. All the panelists, it's been wonderful to hear the various insights that you have provided, from the emotional to the physical to the policy related issues. I think we've covered a great deal of ground today. Once again, I'd like to remind you that this is the first of 3 webinars. The next will be on October the 2nd, at which time we'll be looking at somewhat of a different facet of the issues of the pandemic. We'll be looking into new practice solutions which may be working to identify and assess the best practices and the measures that were taken during the pandemic by providers, employers, and public agencies in support of the workforce and the population served by the frontline providers. So again, I want to thank everyone, and thank you, Christina Williams, again, for all your support in organizing this, and the Rodham Institute. Be well and be safe, and we hope to see you all in several weeks. Take care.